In this diagram, let's try to understand the management of septic shock, right? From the discussion you've seen, number one concept is repair of the leaky capillary. So leaky capillary means this is a disease process. So we have to halt the progression of the disease. So that is, in our case, is infection. So treatment of infection. So it will have two components. One is IV antibiotics, the must for these patients. And second is source control. If you find a source, there is a central line inside, there is a chemoport, or there is cholecystitis, there is pyelonephritis. All these things you look for in the patient. And you find a source, controlling the source is paramount of importance in our case. Of course, you will start antibiotic as soon as possible. So this will take care of the leaky capillaries, because as soon as you treat the source, treat the infection, the pathology will subside, right? And second concept is, we've seen here, the non-stress volume increases, that means the stress volume decreases. So we have to increase the stress volume. So how to do that? IV fluid. This is one way. And another way is, what we can do, we can constrict the vessels to again become like this. We can use vasopressors to constrict it, right? The second line will be vasopressors. Third concept and treatment will be organ support. We can see here that there are different organ dysfunctions present. So we have to support. Organ support means we have to prevent progression of organ failure, right? Number four concept is associated. For example, many of the sepsis patients, even if you give IV fluid or vasopressors, the vessel, they remain resistant to the catecholamine. So the sepsis, the responsiveness to catecholamine goes away in some patients. So there is role of IV hydrocortisone. Other therapies, like we can give thiamine, vitamin C, we can give ulinastatin, we can give CRT with cytosol.